Good afternoon, my name is Selena, and today I'm going to be talking all about pediatric type 2 diabetes mellitus and why it has become a growing trend over the last 3 decades. So, what is diabetes? Diabetes mellitus is a group of diseases that affect the body's ability to manage elevated glucose levels. Buttermore et al. 2021. It can be classified into 4 main types: type 1 diabetes mellitus, type 2 diabetes mellitus, prediabetes, and gestational diabetes. Type 1 diabetes occurs when the body begins to destroy beta cells in the pancreas, leading to an inability to produce insulin. Insulin is the hormone responsible for converting glucose or sugar into energy and regulating blood sugar levels. This type of diabetes is typically diagnosed in childhood. Type 2 diabetes mellitus can result from either a lack of insulin released by beta cells of the pancreas or from insulin resistance, where the body does not respond effectively to insulin. M. Devady et al. 2021. A significant difference between adult and pediatric type 2 diabetes is that in children, the beta cells in the pancreas deteriorate much more rapidly, making pediatric type 2 diabetes more aggressive. Tippus et al. 2024. Prediabetes is the stage that precedes the development of diabetes, and gestational diabetes occurs during pregnancy. Although type 2 diabetes has traditionally been associated with adults, there is an increasing number of children being diagnosed with this condition. What are the causes and effects of type 2 diabetes mellitus? Pediatric type 2 diabetes mellitus is strongly associated with childhood obesity. However, not all children who are diagnosed with obesity will develop pediatric type 2 diabetes mellitus. The location of fat accumulation plays a crucial role, with hepatic steatosis, fatty liver disease, and visceral adiposity, the accumulation of fat around the intestines, heart, and liver being significant risk factors. Shaw et al. 2022. This accumulation of fat tissue leads to the secretion of pro-inflammatory adipocytokines, or fat cell signaling proteins, which contribute to insulin resistance. Sinivaratne, SN, and Rajendra 2022. Why is it a growing trend? The increase in pediatric type 2 diabetes mellitus is closely linked to the global obesity crisis, which is driven by several factors. One primary factor is diet. We live in a world where there is more access to cheap, sugary, fatty, and processed foods than there ever has been. Additionally, the more sedentary lifestyles that children lead today make it increasingly difficult for them to burn off all the extra calories they consume. Shaw et al. 2022. What are the physical health consequences of pediatric type 2 diabetes mellitus? Type 2 diabetes is more aggressive in youth than in adults and is associated with a greater risk of complications. A. Service et al. 2021. Young individuals diagnosed with type 2 diabetes mellitus are more likely to experience hypoglycemia, diabetic kidney disease, hypertension, dyslipidemia, and microvascular complications such as peripheral neuropathy and retinopathy 15 years after diagnosis. Titmus et al. 2024. What are some mental health concerns of pediatric type 2 diabetes mellitus? Type 2 diabetes mellitus can exacerbate the mental health challenges that young people face in their daily lives. It can interfere with their body image and influence their self-perception. Additionally, the weight of the diagnosis itself can be burdensome. A study published in the Canadian Medical Association Journal found that teenagers often struggle with accepting their diagnosis, along with the stigma and shame associated with type 2 diabetes mellitus, as well as the daily self-management tasks it entails. Wicklow et al. 2021. Diabetes can also lead to what's known as diabetes distress, which is an emotional response to the ongoing treatments, management, and decision-making necessary for living with diabetes. Although there is limited research on the connection between pediatric type 2 diabetes mellitus and depression, it is known that 1 in 4 adults with type 2 diabetes mellitus experience depression. Semenkovich et al. 2015. How is diabetes managed / treated and prevented? Pediatric type 2 diabetes is a relatively recent phenomenon, emerging over the last 3 decades, which means there is limited research on effective treatment methods. Most studies involving children and youth have focused on type 1 diabetes, as it is more commonly diagnosed in this age group. However, the treatment approaches for type 1 diabetes are not appropriate for pediatric type 2 diabetes. And although type 2 diabetes in adults is the same disease, children experience a different hormonal environment that affects their condition differently. Springer et al., 2013. Despite the limited research on pediatric type 2 diabetes mellitus, most experts agree that the effective treatment requires a team approach. This team should include a pediatric endocrinologist, a diabetes nurse educator, a nutritionist, and a behavioral specialist. Springer et al., 2013. If this comprehensive team is not available, a patient's primary care doctor may offer support following published guidelines. Service et al., 2021. This collaborative approach helps ensure that patients acquire the knowledge and skills necessary to manage their condition and prevent complications or diabetes-related distress. In certain cases, patients may need to use metformin and insulin to stabilize their blood glucose levels. Service et al., 2021. The treatment of pediatric type 2 diabetes mellitus should be viewed as a family effort, as family support is crucial for the success of most treatments. Since pediatric type 2 diabetes mellitus is closely linked to childhood obesity, it is essential to make changes in diet and physical activity. Consulting a nutritionist is recommended to develop a meal plan that is both culturally appropriate and economically feasible, with the aim of reducing the patient's body mass index or BMI to a healthy level. Service et al., 2021. In general, it is advisable to limit the consumption of sugar-sweetened soft drinks and fruit juices, reduce the intake of processed and prepackaged foods, and minimize the consumption of refined sugars and corn syrup. Additionally, decreasing both saturated and total fat intake, increasing the consumption of fruits and vegetables, incorporating more fiber-rich foods such as whole grains and legumes, choosing foods with low glycemic index, and practicing better portion control, and avoiding eating meals while distracted are all important strategies. To ensure the dietary goals are being met, it is recommended to schedule an appointment with a nutritionist every 4 weeks. Service et al., 2021. There should also be an attempt to live a more active lifestyle, as this helps with managing blood glucose levels. Insulin resistance and stopping the destruction of beta cells, which is a major concern for pediatric type 2 diabetes mellitus. Service et al., 2024. An effort including the whole family should be made in order to get the patient to 1 hour of moderate to vigorous activity a day. Service et al., 2021. These changes should be engaging and attainable so that the patient is able to stick to it.